My dog has 2 epulis on her gums, both about 1 centimeter in diameter. We don't have the funds for surgery at the moment.
How long can we
postpone it? I brush/check her teeth daily.
I think the fact that she allows to have her teeth brushed and checked frequently is really good. Epulis is kind of an antiquated term for a lump in the mouth.
Oh.
So it doesn't actually mean very much to me. And the veterinarian maybe just called it that because it's just an umbrella term. 1 centimeter is pretty big for an epulis. So the traditional definition of an epulis is a benign tumor arising from the gum line. So the name has changed, but if it is truly a benign tumor arising from the gum line, then it's unlikely to cause any sort of significant danger to the dog's health. But the challenge is that you don't actually know if that's what one or both of the lumps he describes are. So keeping a really close eye on it for rapid growth is definitely the thing to motivate to try to find a way to get them taken care of. If they grow rapidly, then that's a sign for concern. And if they're staying relatively stable and they're not terribly inflamed and the teeth that they're next to aren't getting loose, then you can take a little more time.
As far as being able to diagnose lumps in the mouth, because there are so many different things that they can be. Dogs can have
cancer
in their mouth. Cats can, just like people. That would be my question, is how did they obtain the diagnosis? And wouldn't you need some type of a biopsy to be able to diagnose it? Or is there somebody out there who's confident enough who just by
the appearance would
feel comfortable making that call?
I think I would be a little bit suspicious of anybody who felt 100% confident making that diagnosis off of just a visual exam. So yeah, you're right, just biopsy. Unfortunately, the nature of the tissues of the gums, a fine needle aspirate doesn't usually yield much of an answer. And a conservative biopsy in many cases also doesn't yield a diagnostic result just because there's so much inflammation that if you just take kind of a surface piece of tissue, you may just get inflammation and not get the actual bump.
It sounds like probably want to watch it very closely and ideally get a biopsy as soon as possible, just to ensure that it is indeed benign.
Yeah.
With oral cancers, just even in the last 10 years, so much has changed. I remember for the first time I started seeing patients receiving an actual vaccine for oral melanoma. Mm-hmm. Had you seen that?
Yeah.
It sounded like really amazing technology.
Yeah, it can be very useful, I think, depending on the case. It's always used adjunctively. It's not a standalone. So basically with every oral tumor, the best course of therapy is complete removal. And then there's those other things you can add on, like the melanoma vaccine or chemotherapy or radiation, are kind of the 3 main categories.
Like residual microscopic disease. Or,
right.
Well, that is very helpful. I think we answered that.